I wanted to share with you what we're seeing in our OZEMPIC patients. We do have quite a few patients who are on this medication or this classification of medication, the GLP-1s, which does come under different names, like Wegovy or Zepbound, but they work essentially the same. What we're seeing could basically fit into one of three basic categories, and this can also change the longer they take the medication. Category number one. This category of patients are having some success as far as weight loss. They are losing 5 to 10 to 15 pounds primarily, and then it might plateau a little bit, but they are content and happy with that initial weight loss. There's no doubt in my mind that people are losing more than 15 pounds on these medications. I'm just telling you what we're seeing mostly. Many of that first category of patient are feeling good, they're not having side effects, and it would appear to be a thumbs up situation for this medication and weight loss. But that's definitely not everybody. Category number two is a patient category where they take this classification of medication and they're experiencing no benefit. They're not losing any weight, they don't feel any better, and what typically happens in this category is that the medical doctor gives them a different version of the drug, but it just doesn't work for them. So they're not getting the benefit, so they stop taking it. I even had a medical doctor come to me in this category, and they were quite frustrated. Keep in mind, this is a significant number of these patients in this category. It's not like everybody just starts losing weight. It's just not happening that way. The third category are patients that are having severe negative reactions. They feel sick right away. They're having a lot of gastrointestinal issues, and there's no way they can continue. Once again, they're switched on to a different drug in the same category if they're willing, but they continue to have negative symptoms. I even had one patient claim that they gained weight taking this medication, and my thought about this, my hunch is that they had some decreased appetite during the day, but because of the consumption of alcohol, it offset that, and they ate more when they drank, and add some bloat, water weight, and you've got some weight gain. I'm also seeing a combination of category number 2 and 3, right? These are people who didn't feel any improvements, but shortly after taking it, they started feeling really bad. And then we also have category number 1 and 3, where they took it for a while and they felt great, but the side effect profile is accumulating over time. Your body is starting to get slightly damaged, but that damage and that irritation, especially to the GI tract, is going to compound the longer you take it, making the side effect profile exponential as time goes on. This means that there is very likely long-term use risks that are not currently being reported because nobody's really been on this medication too long. And this leads me back to our first category of success patients, and the question becomes, is this sustainable? You have somebody who's 40 years old and they're improving that first year maybe, but are they going to stay on it another 45 years of their life? And then where are they going to get off of it? Are they going to get off of it once side effects and damage has reached a point where they're forced off of it? And also, is there going to be rebound weight gain or disruptions to the rest of the hormone system, the liver, the gut? And one of the worst things that could come out of this is if there's a change to the apostat where cravings are increased after stopping the drug. And this could result in binge type eating that we see with so many other medications that have an appetite suppressant mechanism, is that once you come off of it, your appetite is ravenous. It's far more increased than before you started the medication. These are all questions I have, and they're largely unknown. The reality is that this is the ongoing experiment. This medication is being used in massive amounts with large populations of people, and we're going to see over the next few years what happens with that population, if they're willing to share it with us. Because a lot of people I know who are taking it do not want other people to know they're taking it. And maybe they're spending money they don't have just so that they can get their looks and lose a few pounds, when most of us know that that can be achieved through holistic care and diet and exercise, but that does take work, and I get it. I've gained weight, I've lost weight. I understand the dilemma, but I think that this medication, in my professional opinion, is probably not worth the risk when we look at the trajectory of it long term. I'd love to hear your thoughts and experiences in the comments. Together we can learn a little bit more about what's going on with this medication.